Well, nice to meet you. My name is Dion. I am a charge nurse at Scientific Diagnostics. I currently do interventional radiology
Okay.
in the procedure rooms with the docs. But it's not about me today, it's about you. So tell me about yourself.
So I guess shorthand of my life story is I was born in Israel. Then I went to California when I was 1 year old. Spent about 7 or 8 years over there. Then I moved to Las Vegas, and I've been living here ever since. Then I went to Desert Oasis High School for my high school years. It was pretty uneventful until I got into doing something called the Las Vegas Fire Explorers, and it's kind of like a volunteer slash apprenticeship kind of Boy Scout kind of thing for young men interested, or young people in general interested in the fire department. So I did that for about 4 years because I didn't really know what I wanted to do when I was growing up. I just like, okay, firefighter, that sounds like fun. So I just kind of did that for 4 years. And so when I was doing that, and at the same time, I was also working for MGM Grand, and I was also pursuing education at CSN.
Okay.
And when I was doing the fire explorer thing, a lot of times I would be going to hospitals, and I started to interact with a lot of doctors. I interacted with a lot of nurses, and I got really, really fascinated with the hospital, specifically the ER.
Okay.
And that's kind of where I'm hoping to end up as a nurse. I want to end up as an ER nurse because that's where I got a lot of my fascination. So I kept going to hospitals, and I just like, you know what? I like the fire department, but you know what? I think I like this more. And so a couple years later, I went to Nevada State College because I heard they had a good program for nursing. Got myself into the program, and the rest is history. Now I'm here.
Yes, now you're here. That's amazing. So, what is your greatest strength?
Um, I would say my greatest strength is resilience. I have had a lot of I don't want to use the word obstacles, but I've had a lot of trials that I've been able to push myself through and just get to the next step. So, for instance, when I got into before I got into nursing school, I said I was working at MGM Grand. I was working a night job, so my shifts were 11 to 7 a.m. And when I was getting ready to get into the nursing program, I had to take a lot of prerequisite courses. So right now my course load is anywhere from 1 to 2 classes at most. When I was getting ready to go into the nursing program, I had to take my prerequisites, and I was taking anywhere from 4 to 6 classes at a time. There was one semester I think I was taking 18 credits.
Oh,
So
wow.
it was a lot of intense on top of going to work at night, 8 hour shifts, for the most part Monday through Friday, and I worked as a stove cleaner, so it was a lot of manual labor.
Okay.
But my resilience kind of kicked in, and I think I got a lot of that from the whole fire explorer thing too, where I'm like, I'm just gonna keep pushing through to just I don't know, I just kept pushing through. So that's where I'd say my biggest resilience is. So that kind of translates to the workplace, where if I run into trials and obstacles and things like that, I'm not going to buckle down. I'm going to say, hold on, let me see if there's more. I'm going to keep trying at this. That's kind of where I would say my biggest strength is, because I'm not a know-it-all. I don't have all the answers. I get so many pointers and tips about how to study from my classmates. I'm just trying to do my best, and it sounds kind of corny, but not give up.
Okay, that's not corny. What is your greatest weakness?
So my biggest weakness, I would say, is time management. This has been something consistent with my studies in particular. A lot of times I get swept up with small distractions. Maybe there's something I need to clean up around the house, or maybe there is something on the news, maybe it's social media, but it's often gotten to a point where I lose track of the important things, and right now the most important thing is my studies. So that, I would say, is my biggest weakness. That being said, I have it to some degree under control, because what I'm trying to do is, I already understand, for instance, I can't get rid of social media, for instance. So what I'm doing is I'm prioritizing goals first. So if I'm going to do social media, let me at least get this chapter done, and then I'll reward myself with 5 minutes on YouTube or this or that, and then I'll get back to work.
Okay, so that's pretty good. So, how do you relax when faced with a stressful situation?
So I don't really have. I've never particularly had a problem with stressful situations because from the very get go, when I got into high school, I went right into the fire department. So I've seen, and I want to go into the ER. So I've always been mentally preparing myself to get into stressful environments. And then it also kind of depends on how you kind of define stressors because there's like literal stressors. So say for instance, a little bit graphic, like seeing people go into cardiac arrest, seeing people that are deceased, whereas seeing how do you handle criticism from a boss, all these other kinds of stressors. So it's a little bit, it depends on the situation, but from the very beginning, I've always tried to build myself as someone that can function in a high stressful environment because that's why I kind of perceive the ER is going to be. I'm perceiving I'm going to get a lot of patients. I'm going to be have a lot of demand. I'm going to have to move and think on my feet. As far as how I stay calm in those kinds of situations, I think it really just comes back down to this resilience I have. I try to be very flexible and open-minded and just look for the right answer for myself.
Okay. How would you respond if, in a rude and haughty tone, a doctor questioned your work, which you know to be top-notch and absolutely accurate?
The most first immediate instinctual thing I would do is I'd ask for clarification on what specific problems that the doctor has with my paperwork. If I'm confident in my work, and I'm pretty sure I will be, I'm going to be very familiar with how I set things up, and maybe there's oversights, and I'm human, I'm going to make errors, and I'm going to learn from them, but I'm going to always set myself up for success. That being said, when errors do happen, I'm going to not run away from them. I'm going to own up to them. But I'm also going to ask for clarification. Where's the error, though? Let me go take a look at what's going on and see what led myself to that conclusion.
Okay. How will you handle unexpected circumstances such as being short-staffed and having to perform a treatment you have not done before?
So, this is kind of maybe another weakness of mine because I have this desire to just build myself to be resilient to the point where it's like I want to not have a problem where people ask me, can you stay another shift? Can you work these extra hours? Can you handle this other patient? I want to build myself to be that best type of a nurse. And my desire is to just I want to meet those expectations, but I don't know what is going to prepare me to get to that point in time.
Okay.
But it's always my desire to meet those expectations, no matter how strenuous they may be. It is my desire in the first place to be that multifunctional nurse.
Okay. Describe a time when you have to intervene for a patient. What you did and why? What was the outcome?
Intervening for a patient.
Example, like maybe when you were doing your clinical rotation, you might have had to advocate for a patient, or example like that one, anything like that.
I'm trying to think of some patients where I've had to intervene in care. The most recent patient I can think of that I ended up intervening in the most literal impact to their life is I was handling a patient that was going, they were in the hospital for a lot of reasons, and when I was talking to them, they were alert and oriented, and then eventually got to a point where she started to change in mentation a little bit, and then we started to ask more questions, and then she started to go into a code. So this led to, and it wasn't immediately a code. At first it was like we needed to call it a rapid, then it progressed to a code. And so my intervention during that point in time was to kind of recognize the signs that she could be going into cardiac arrest, and to suggest that to the nurse that I was working under at the time. And so that progressed to a full code, and the most literal manifestation of the intervention I had is I was doing chest compressions and performing CPR. We managed to save the patient, but it was not messy, it was a very complicated situation because I had no experience at the time. I've never seen somebody go into cardiac arrest. I wasn't sure if that was even happening. All I know is that she just something looked wrong. Like her eyes rolled up, and I'm like, what is going on in front of me? It was the first time I saw that. I'm like, is this cardiac arrest? Is what's going on? So I asked all of my questions to my nurse, and she was rapid. I need rapid. I need to call code blue, and then that's how it starts. So that was my first experience in a type of intervention.
Okay, I like that. So, why should you be hired, or what makes you right for this job? Or what do you bring to the position, and how do you stand out from the other applicants? So, I'm about to hire you. Why should I hire you? What are you bringing to the table? Why should I hire you out of all these other applicants?
Putting my strengths, my weaknesses aside, I'd say a good reason to hire me is I have a different perspective. So I would say, first off, nursing, in my humble opinion, is a predominantly female occupation. The majority of nurses that are in the nursing field are female.
Okay.
So when I come into this domain, I'm offering a male perspective. I have seen a lot of my shortcomings, and I've seen a lot of my strengths, and I've also seen that I can be a good fit in certain situations. I can also be a better fit to let others do their own kind of activity. And it's like, it's hard to put it into words, but I think I can offer a different male perspective. That's the best way I can put it.
Okay. Hey, no answer's wrong. I like that. I don't know if I asked you this, what is your important accomplishment today? Or what accomplishments have given you the most satisfaction in life?
The most important accomplishments, I'd say the biggest accomplishment I've had, or the biggest accomplishments I've had, the first of was getting into nursing school. It took a tremendous amount of work to get into nursing school because I had night work. I had to do a lot of classes to qualify to get into the program, and the GPA competition was very, very, very high. So getting into nursing school, that was probably my biggest achievement. Some other smaller achievements that I can think of is just I'd say getting through every semester through nursing school is achievement. I'm currently in my 8th semester, my last semester. My 6th semester was one of the most difficult semesters to get through. It was the last semester of medical surgery, intensive amount of information to get through, and I managed to get through that. My 7th semester was always very tricky. Was particularly very tricky because there's a lot of projects on top of the actual test load. So getting into nursing school is probably my biggest achievement, and getting through each semester is a lot of other subsequent achievements after that.
Okay, all right. Well, we only got a few more minutes left, so I'll give you a couple feedbacks. I like that, you showed up ready to go. You were prepared. Your introduction was great. The way you communicated with me I liked it. You were clear, cut, to the point. You answered my questions, and you remained calm throughout the whole time, and you took your time in answering those questions. I do like that. Do you perhaps have a resume on you?
Yes.
Okay.
Sorry, I didn't give that to you
No,
earlier.
it's okay. So I was going to say, Let's see. Perfect, perfect. So when we do start, just next time, I'll have your resume ready and just go ahead and hand it to me in the beginning. At least it'll give me some time to overlook everything.
Okay.
So if I want to just, glance at it so I can see what kind of experiences, it's ready to go. But other than that, I do like the fact that you articulated very well to me your experiences and answered the questions really good. Do you have any questions for me?
No. Thank you for your time.
You're welcome, and you have a great day, okay? And thank you for your time.